Welcome to the deep dive. Okay, if you're a Canadian who loves to travel, maybe planning that big 2 week European adventure, or maybe you just, pop across the border for a couple of hours for shopping this deep dive, it's definitely for you. Yeah, we're tackling something that honestly almost everyone seems to underestimate. What actually happens with your reliable Canadian healthcare, your MSP, your OHIP, that provincial health card, the very second you step outside Canada?
And today, we're pulling some really crucial insights from a licensed insurance advisor who actually specializes in this stuff for Canadians. Harry Nathan Roy works with folks in BC and Ontario, helping them figure out these, complex cross-border financial risks. Our mission today is pretty straightforward. We need to bust that myth that your home province has your back financially when you're abroad. We have to sort of quickly lay out the potentially devastating costs of getting sick or hurt outside Canada and really clarify why travel medical insurance isn't just nice to have, it's essential.
Okay, let's unpack this then, because the info we're about to get into, it isn't just about saving a bit of hassle. It's potentially about avoiding immediate, life-changing medical debt. So let's start right there. That core assumption, the one that trips up so many travelers. In Canada, we're just so used to showing our provincial card, getting care, and that's that. So what's the official cold, hard truth when a Canadian crosses, say, into the U.S.? Do I get any coverage from my province?
Well, you do get some coverage, technically. But the reality, it's pretty harsh. Your provincial health coverage, it's really designed specifically for care within Canada. It's based on Canadian fee schedules. It just doesn't truly travel with you in any financially meaningful way. Here's the breakdown, and it can be, frankly, brutal. When you need medical care abroad, especially somewhere like the U.S. or maybe Mexico, you're dealing with private international healthcare systems, and they bill based on their own rates, which are usually much, much higher.
Right. So let's say I don't know, break my leg skiing in Colorado. The hospital hits me with a $15,000 bill for the emergency room, maybe a simple cast. What does my Ontario plan, my OHIP, actually contribute to that?
Okay, so your provincial plan looks at that $15,000 bill.
Yeah.
They compare it to what they pay here in Canada. They might say, well, we'd pay a Canadian doctor maybe $50 for that service and perhaps another $25 for the facility fee. The upshot is provincial plans often reimburse a really minimal amount, sometimes shockingly low. We're talking maybe less than $75 per day towards that hospital stay.
Less than $75. Wow. That's staggering. So the gap, the difference between that $15,000 bill and maybe $75 back from the province, that's just sitting on my credit card now. And that's only the initial visit.
Exactly, and that's really the massive takeaway for this first part. When a Canadian relies solely on their provincial plan outside the country, they are, in effect, self-insuring against potentially catastrophic foreign medical costs. And here's another critical point. The tiny provincial reimbursement doesn't help with the immediate payment.
What do you mean?
You're typically expected to pay that foreign hospital up front, or at least provide a hefty credit card guarantee before they even treat you sometimes. The province. They only reimburse you weeks, maybe months later, and only at that minimal Canadian rate.
Wow. Okay, so the risk isn't just the final massive bill, it's also the immediate cash flow problem. Like being faced with a demand for thousands of dollars right then and there, possibly before they even start treatment. This really shifts the conversation, doesn't it? It points directly to needing proper, comprehensive travel medical insurance.
It really does. And what's crucial to grasp here is just how much real travel medical coverage actually protects you. It completely changes the situation. It moves it from being potentially a huge personal debt crisis to more of an administrative issue for the insurance company.
So when we look at the scope of a good policy, it covers way more than just the basic hospital bill, right? What are the key things you'd expect an adequate policy to include?
Definitely. We're talking emergency medical treatment, obviously. That's the core. But also those critical components like ambulance services, ground, or even air. Necessary prescriptions, diagnostic tests, x-rays, things like that. But it's also about having someone in your corner. A good policy means you make one call to a 247 assistance line and they start dealing directly with the foreign hospital's billing department. You don't have to. But perhaps the single most expensive and potentially life-saving inclusion is air evacuation. Getting you back to Canada if the medical emergency is serious enough, this is where the costs can just become astronomical.
Let's pause on that for a second. Air evacuation. Why is that so critical? And what kind of costs are we actually talking about? People hear policy limits like up to $10 million in coverage, and it just sounds like this abstract, huge number.
It does sound high until you understand what that service actually involves. Imagine you have a major accident or a really serious illness, maybe in a remote part of Mexico, or even in parts of the U.S. that are far from top-level specialized care. You might need a medically equipped private jet with doctors, nurses, specialized equipment on board, flying you across international borders back to a Canadian hospital. That's not just booking a seat on Air Canada. These specialized medical transport services, they often start around $50,000. And they can easily soar past $200,000 depending on how far you need to go, the medical team required, the equipment needed on board. Suddenly that $10 million policy limit doesn't seem so abstract, does it? Especially when you're facing a potential $250,000 transport bill that your provincial plan will absolutely not cover a penny of.
Okay, yeah, that definitely puts the need for high coverage limits into perspective. And it's not only about those really dramatic life flight type medical events, is it? Good travel medical insurance often bundles in non-medical benefits too, things that just provide extra peace of mind.
Absolutely. Think about trip interruption coverage. What if you have a family emergency back home and have to cut your trip short, losing all those prepaid hotel nights and flights? That can be covered. Or help if you lose your passport or other vital travel documents. And importantly these days, modern policies often include coverage for unexpected quarantine expenses if you get stuck somewhere due to, say, COVID or another infectious disease outbreak. That can mean days or weeks of extra hotel and meal costs you didn't budget for.
Right, that's become really relevant. Now, since we're talking about how necessary this is, let's maybe pivot to the people who face this risk perhaps most consistently. The sources we looked at highlighted specific groups, particularly professional truck drivers or maybe other workers who are crossing into the U.S. almost every week for their jobs.
Yes, these groups face that financial danger constantly. Every time they cross the border, which might be several times a week, their provincial health plan effectively stops covering them meaningfully. The advisor we drew from, InsureWithRoy, shared a really powerful story about this. It perfectly illustrates how a seemingly common event can instantly become a massive debt problem without the right insurance. So the story goes, there was this truck driver. Had a relatively minor incident on the road in the States, nothing catastrophic, didn't need surgery or anything, but it was enough that he needed to go to a local hospital, get checked out, maybe some diagnostics, observe him for a short while. The result, an immediate hospital bill for over $15,000.
$15,000 for what sounds like, I don't know, a minor checkup after a small accident, something easily recoverable.
Exactly. Minor incident, major bill. Now, if he had only relied on his Canadian provincial plan, he would have been personally on the hook for almost all of that $15,000 for just a simple work-related checkup. But because he had proper travel medical insurance, the insurance company handled it. The claim was paid in full. He could focus on getting back on the road, not figuring out how to avoid bankruptcy. It just shows the risk isn't just for big vacations, it's an everyday risk for some.
Okay, here's where I think it gets really critical for maybe the average Canadian, not the professional driver, but maybe someone living near the border. You know, the short trip trap. We think, oh, I'm just popping across for 2 hours to grab some duty free, or it's just a quick weekend getaway. I don't need insurance for that. What's the flaw in that thinking?
The flaw is pretty simple. Emergencies don't care about your itinerary. They don't check how long you plan to be away. A sudden unexpected illness, severe food poisoning from a quick lunch, or just slipping on some ice in a parking lot. These things can happen literally minutes after you cross the border. And if that simple slip results in, say, a broken hip needing complex surgery in a U.S. hospital, the bill you face is going to be exactly the same whether you plan to be gone for 2 hours or 2 weeks. The cost of care doesn't change.
So for that person who does cross frequently, the regular shopper, maybe someone with a weekend place just across the line buying a separate single trip policy every single time they go seems, well, really cumbersome and probably adds up cost-wise too. What's the better solution that the advisor usually points to for people like that?
Yeah, for those frequent travelers, the absolute best approach usually is an annual multi-trip plan. These policies are designed exactly for this. They cover an unlimited number of trips throughout the year, typically up to a certain maximum duration for each trip, maybe 30 days, maybe 60 days, sometimes less.
An annual multi-trip plan? Okay, that sounds convenient covering limited trips, but it also sounds like it might be really expensive given that frequency.
Well, that's often the surprise for people. Now, the cost does vary a lot. It depends heavily on your age, any pre-existing health conditions you might have. But for a generally healthy, maybe younger person who crosses the border often, these annual plans can be remarkably affordable. Sometimes you can find good ones for under $100 a year.
Under $100 a year. For potentially unlimited trips, that sounds almost too good to be true, especially when you compare it to that $15,000 bill for one minor incident we just talked about. If an annual plan is that cheap, what's the catch? Where do people need to really read the fine print?
That's a really important question. The main catch, if you want to call it that, usually lies in the maximum duration allowed per trip. So that plan under $100 might only cover you for individual trips that are, say, 7 days long, or maybe 15 days long. If you then take one single trip that lasts 16 days, that entire annual policy might be completely void just for that one longer trip. You also really have to pay close attention to the stability clauses related to pre-existing conditions. Which brings us nicely to our next really crucial point, and that is choosing the right protection for you personally. It's not one size fits all. The advisor we're referencing, InsureWithRoy, offers a really simple but powerful framework. It helps cut through all the noise you get when just trying to compare quotes online by yourself.
Okay, and that framework, it starts the traveler looking inward, right? The first key question you absolutely have to ask yourself, honestly, is how often do I actually travel outside Canada? And critically, what's the maximum length of any single trip I might take?
It's exactly. Understanding your travel patterns, frequency, and duration helps to determine if you just need a single trip policy for that one big vacation, or if that more economical annual multi-trip plan makes more sense. But the next question, well, this one is probably the most sensitive, both legally and financially.
And that second crucial question is, do I have any pre-existing health conditions, even minor ones? And how might those conditions impact my coverage eligibility or potential claim?
This is honestly a massive point of failure for a lot of Canadians buying travel insurance. You might have been diagnosed with something that seems minor, let's say high blood pressure, hypertension, maybe just 2 months before your trip. If you don't disclose that accurately on your application, or if you buy a policy that has a clause requiring that condition to have been stable, maybe no medication changes, no new symptoms for, say, 6 months before you travel. If you then have a medical emergency related to that condition, even indirectly, the insurance company can, and frankly, likely will, deny your entire claim.
Whoa. So hold on. Even if the insurance company initially helped out, maybe paid the hospital upfront through their assistance service, they can actually come back later, find out about that undisclosed or unstable condition, and then claw all that money back, leaving me with the full hospital bill after all.
Absolutely. Remember, an insurance policy is a legal contract. If you breach the terms of that contract, especially concerning disclosure of pre-existing conditions or meeting the stability requirements, the insurer often has grounds to void the contract retroactively. Basically, act as if the policy never existed. That's precisely why getting advice from a licensed professional and advisor becomes so important. It's not a luxury. It could prevent a financial disaster.
Okay, that makes sense. And that leads right into the third question you need to ask, which ties it all together. Based on my travel habits and my health profile, am I looking for a single trip policy or that annual coverage? We've talked about the cost differences, but is there usually a difference in the level of service or assistance you get?
The service level, like the 24/7 assistance, should generally be the same whether it's single trip or annual. The real key, though, is making sure the advice you get helps you select a policy that truly fits your personal situation and history. Professional guidance helps you avoid those devastating pitfalls we talked about, like accidentally not disclosing something properly, or simply misunderstanding a crucial policy limit, like that maximum trip duration on an annual plan that you might have overlooked if you just click buy online. They help tailor the coverage to your specific health timeline and travel plans.
So the relevance to you, the listener, the traveler, is really straightforward. Everyone's situation, everyone's risk profile is unique. Your age, how often you travel, where you go, your specific medical history, all these factors dictate which policy is actually the right one for you. And getting professional guidance is pretty much the only reliable way to ensure that the coverage you pay for will actually be there, protecting you when you need it the most. Ultimately, I think the big takeaway here is pretty clear. Travel should be about the adventure, right? Making memories, relaxing. It shouldn't be overshadowed by the fear of crippling medical debt. The decision to get coverage is really just a simple calculation. You trade a small, known, predictable cost, the insurance premium, for protection against a potentially huge, unknown, and frankly life-altering cost, that massive foreign medical bill.
So what does this all really mean for you? It means getting proper travel medical insurance isn't just a good idea. It's not a recommendation. It's really a core necessity if you want to protect your personal financial stability. It's what gives you the actual freedom to explore the world without that huge financial cloud hanging over you. It's vital not to confuse our wonderful domestic system, our provincial healthcare, with international financial protection. They're fundamentally different things.
So here's the final thought to leave you with. Given that the experts confirm that serious emergencies, something as simple as a slip and fall or a bad case of food poisoning, can happen literally minutes after you cross the border, how much is that peace of mind actually worth to you? Especially when you weigh it against the very real, proven financial risk of leaving your Canadian coverage behind. What's your concrete plan going to be for the next time you leave Canada, even if it's just for a couple of hours across the line?